Good evening. I wanted to hop on here quick and just touch base with everybody. I've had a lot of questions from people on Facebook, from my family about COVID-19, which is coronavirus. It's all over the news. You really kind of have to try hard to avoid hearing about it. And I am going to just talk a little bit about my thoughts and some suggestions, and then I'm going to try not to focus on it for a little bit tonight, at least. So this is obviously a worldwide pandemic. Different countries have handled the situation differently and have had different levels of success. You've probably heard the idea of flattening the curve. So basically, if everybody keeps doing what they've been doing normally in life and going about their days and being around people and being in crowds, there's going to be a lot of infections. And that curve is going to be really high and really tall because everybody is going to get really sick all at the same time. And that's where the healthcare system is going to be taxed beyond their ability to really care for people. That is going to make people who are in healthcare sick. That is going to limit the resources in our hospitals. And in countries like Italy right now, and in the last few weeks, they've actually had to make choices and really decide who gets a ventilator and who doesn't. It's like wartime. They're deciding based on comorbid conditions, what the patient's previous health was, how old they are they even going to try to save them? And that is so scary. And that could for sure happen. Influenza is still active in the United States. And so hospitals are at capacity right now for the most part. So adding another 10, 100, 1,000 cases of the COVID-19, that's going to just be too much for our healthcare system. So that's why the public health officials are really focusing on this social distancing, and the schools are being closed and restaurants are being closed, and different public areas, our local mall, reduce their hours. It's just a matter of staying away from people, because you can be infected with the virus and not have symptoms and pass it along to other people. And that's something that I'm not sure that everybody is really thinking about. I'm relatively young, relatively healthy, and I still know that I am going to be in contact with it. I think it would be hard to say that anybody in the United States is not going to be in contact with it. And then I could conceivably pass it along to other people. I know that my job will be changing in the capacity. I'm not sure exactly when, and I'm not exactly sure how, but at some point we may need to change how we use our resources, how we use our nurses, how we use our healthcare providers. We may not be able to do just plain wellness visits because there's just too much risk for people to come in and have a regular wellness visit because of all the illness that's around. The other thing that the facility that I work with has in place is a phone number to call, so that if you think that you have been infected, you call a number and they walk you through a series of questions for screening, and they decide whether or not you should be tested. And they will facilitate how that happens, whether it happens at your house, whether it happens in an emergency room at a clinic. But what we don't want people to do is feel like they're sick and they have a fever and they have a cough and they've been in contact with somebody and like go right to their walk-in clinic or their primary healthcare provider, because one, we don't want your germs. And two, we don't want you getting infected with influenza and strep throat while your immune system is down. There's other illnesses at the clinic or at the emergency room or at the healthcare facility. We don't want you to get sicker than you already are. So that's why we're kind of encouraging people to stay home. I had influenza for the first time this year, and symptoms were totally manageable with over-the-counter medicine. And that's what people really need to focus on, is staying home and treat your fever, treat your cough, use over-the-counter medications. If you're having dizziness, if you're having confusion, shortness of breath, if you're a person, especially who is older, has pre-existing conditions with problems with your lungs, your heart, that sort of thing, those are reasons, that certainly you'd want to go to the emergency room, get your care, because a certain amount of the population, probably 20% or so of the people who do get the COVID-19 are going to end up with pneumonia. And a certain percentage of that group of people is going to end up in the hospital and be really sick. So if you are at risk for getting really sick, and you know who you are, right? You're the people who are like just at risk for everything. Then you need to be more careful, and you for sure need to stay home, and you need to not have people come and visit you. And I'm really sorry, and that sucks. And it's going to be an interesting world for the next couple of weeks. But this is what we need to do to flatten out that curve, to make sure that people are not all getting super sick at the same time, to make sure that we just decrease the transmission of disease and keep people healthy. So, like I said, I'm sure that I will be in contact with it at some point. I am sure that I can fight through it. I have a strong immune system. Most of you out there have a strong immune system. But for the people who don't have a strong immune system, we really need to step up and help them and use our healthcare appropriately. So please ask me if you have questions. I would love to answer any questions. I am not an expert. I'm not an epidemiologist. I'm not an infection control specialist. I'm just sharing with you what I know. Also, if you're just curious about the immune system and what can make it stronger, I'll talk more about that tomorrow. I also have some friends doing a Facebook group that starts tomorrow morning that will be a lot about the immune system. We have some other healthcare providers who are going to talk about that, how to strengthen your immune system, how to help yourself fight off diseases like this. And so I think that'll be really interesting. If you are want to be in on that, please let me know. It would be awesome. And thank you so much for listening and watching. If you found this helpful in any way, feel free to share it. Like I said, if you have any questions, please ask me questions. And stay healthy, everybody.